and welcome to the Health Tech Edge, where we talk about the latest topics in healthcare technology with industry experts. I'm your host, Zoe Jacobs. Joining us today is our weekly panelist, Raheel Retiwalla, Chief Strategy Officer at Productive Edge. And our featured guest today is Kyle Koltz, Chief Operations Officer of Third Party Administration at SKYGEN. Welcome, Kyle.
Thanks so much, Zoe. Good to see you again, Raheel.
Same here, Kyle. Good morning, Zoe.
Great to have you on. So today we're going to talk about member engagement and the member experience. Kyle, you've spent 2 decades working at the executive level in healthcare, the last 6 years of which have been focused on benefits administration at SKYGEN. That's mostly specialty benefits like vision and dental. And before that, you were on the payer side with Humana. So how has your perspective changed over that time and within these different areas of the healthcare landscape?
Yeah, that's a really great question. I would say the first 15 years of my experience were really focused with individual medical members who were just trying to get coverage for themselves and their families on their own. And so we spent quite a bit of time just trying to learn what their pain points were and what they brought into the process, like what were they hunting for, what kind of plans and how could they protect their family, things like that. I remember one of the most effective ways that we received insight about their experience or what they were seeking is just doing some basic focus groups with, as an example, like consultants who maybe weren't part of a group plan and they were independent consultants and they just needed healthcare. And so they were often very insightful and would help us determine how we could go to market to help people like them.
It's awesome. And how have you seen member engagement evolve?
Yeah, it's been kind of interesting. I think in the beginning, I think most of the members would try to find like an expert, like a broker, like another person that they could count on because it was very confusing for them. And now it's sort of morphed into digital portals being available, more information being available online, comparative tools being available. And in some cases, I think that helps a consumer or a member. And in some cases, I think it's confusing to them too. So then they need, help to sort and sift through what are the options for them. But I think, with portal sites and now mobile applications that have been developed and things like that, it's really kind of morphed from more of a people and relational kind of challenge into like, how do I deal with all this information and what should I do as a member to protect my family?
So, Carl, as we would in the tech space use the terms next best action and next best recommendation. Completely agree with you. There's a lot of momentum in portals, mobile applications, right? In terms of engagement and member engagement, and trying hard to ensure that they have the right information at the right time and have been, in supporting their decision making as to what's next and the right thing for them to really focus on or do or renew or may have you, right?
Right.
So I'm curious, where do you think all this is going from a future perspective, from a member engagement perspective? There's a lot of data. There are organizations that are going from being payers to also providing care. There's an element of being able to actually assist in the overall health and wellness. So whether it might be coaching, it might be behavioral wellness sort of capabilities. Then there's, of course, as consumers, we all have our wearables and medical devices that also provide more data. Where do you see the pendulum shifting to, and in a way that doesn't overwhelm people, but also isn't necessarily easy to use all that data to actually do something meaningful with it?
Yeah, I would just say that it depends. And one just clarifying comment. Since I joined SKYGEN, I've learned so much about the government programs that exist for products like dental and vision, which I didn't have a big background in previously. And so the answer to your question, I think, depends on the constituency group you're talking about. Like a Medicaid member who's eligible for different coverages, oftentimes they're just trying to find a provider. who can help them and is reasonably local, that they can, take an Uber to, or, that they can get to easily. A Medicare Advantage member may be having very different concerns compared to like a Medicaid member. So, and of course, commercial members have even different concerns. So I think it kind of depends on the consumer that you're talking about, or the consumer group. But I think where it's headed is more of like an ecosystem type of solution, where if you can imagine like putting a member in the middle and then surrounding them with, solution sets, and then helping them kind of guide them through their journey through AI, or through, some kind of prompts that say, hey, this is what I'm trying to do. I'm trying to find a dentist within, 10 minutes of me. And just have that, verbal interaction with an application. I think things like that are very possible, but perhaps we haven't gotten to that point yet in thinking about all of the questions a consumer could ask about maybe their dental product or their vision product.
Yeah, completely. I think that you're absolutely right. I think, first of all, the constituents are different. Their needs are different. Their wants are different. And what they're trying to get value from the healthcare system is different. I wonder, though, based on what you said about the point solutions, there's a significant momentum across the industry and the health IT space, where many organizations are trying to fill that gap, basically saying that, look, member engagement is a challenge. We can do a better job of doing things like population health analytics and risk stratification, and then defining the right strategy for intervention at a population level, maybe at an individual level, and then supporting with point solutions, as you said, that may be specific to things like mental wellness, or diabetes management, or it may be whole health wellness, and many other types. The challenge, of course, and I think in our pre-call you mentioned the idea of coordinating that from a data perspective.
Right.
How is SKYGEN thinking about all of this, and and playing a part in that for your clients?
Yeah, a couple of things come to mind. I think the first thing is just kind of a foundational type of thing. As I mentioned, I think a lot of times we make some assumptions about what a member or a consumer knows they can do, or knows what kind of services they can receive. So we have to start off with things like prevention. Just getting them kind of the basic access to care, and making sure to remind them that they need to see their optometrist, they need to see their dentist periodically. And if they can share that information with their primary care physician at their annual visit, even better. Just making sure that there's a lot of, kind of base level communications. But then, to get a little fancier, like you were talking about from maybe a holistic health perspective, it's creating some more predictability once we know a member has a certain health condition, and being able to proactively drive information to their health providers within their own personal little health ecosystem, so that they're all aware of what's going on. If someone has hypertension, or someone has, is it type 1, or has type 1 diabetes. And so I think that takes it to a different level. And then we get into discussions around, well, what API do you have? Because I have an API over here that I could share with you, but what medical platform are you on, and what dental platform are you on? Those kind of challenges come up. So SKYGEN, I think, is largely trying to help our clients who are MCOs make sure that their members get in to see their healthcare providers, the professionals, just from a prevention standpoint. Now we're starting to get into a little bit more of the fancier things around sharing integrated data with different entities, talking to different players in the industry, that we can hopefully drive toward more of a holistic health solution.
Very, very cool. And just by knowing the value that SKYGEN brings to its clients, it's an incredibly important function. So glad to hear that SKYGEN's moving ahead in that area. But you did mention the government side of things. It's Medicare and Medicaid. Perhaps we'd love to hear your thoughts a bit more on, there's a lot of regulations, laws, as well as, things, financial risk bearing contract, agreements, as well as member engagement. Can you share your thoughts on how all of those sort of dimensions play a role in your clients and SKYGEN thinking about the types of solutions you're working on and types of things that may make it easier for people to benefit from the healthcare ecosystem?
Yeah, no, that's a really good question. I think a good topic for exploration. I think the first thing that I noticed when I sort of left the commercial space and entered into the government space on more of a full-time basis was just the wide variability between CMS and how they sort of view different products and services and their regulation set versus, as an example, Medicaid. And each state has their own view and set of compliance-related issues and regulatory requirements and so forth. So what we end up with today, currently, is we have to be aware of that variability, and we have to, of course, with our own enterprise system software, we have to, be willing to develop solutions that scale for different types of variability. And so that's been one just really eye-opening thing, for me personally. And, just going into an open discussion and trying to say, well, here's what we think the solution is, but we have to always make sure and double check, does this particular state have a similar rule to another state? And so there's a wild need, in my view, for standardization. That hasn't changed. During my 20 years, I would say it's been a fight to try to get standardization just for some very basic things. And I would just be honest with you, in those kind of programs, we're still generating a tremendous amount of paper. Mm-hmm. We're still faxing things like authorizations. We're still faxing, eligibility summaries out to all kinds of different entities. And, so we have a long way to go. We're, of course, trying to convert those solutions into more modern solutions, like just basic email with using links in our portals and so forth. But that is a really good topic. As you can tell, I spent a lot of time thinking about this one. But that's a really good topic for exploration. We could talk about that for a whole one of these shows, I think.
Absolutely, and it's quite amazing to hear, just the sheer amount of work that still needs to be done, and the balance that healthcare organizations have to make between, adopting new capabilities and innovation and addressing, current processes, and it's just it's time, and everything's moving ahead, and it's great to see the movement ahead. But as you said, there's still a lot of foundational work to be done. I'm curious to your thoughts as well. Then, if you were to look at it from a government side, and you kind of zoom in on the dental and the vision providers, what kinds of business model changes are you seeing that add some additional complexity to the mix?
Yeah, that's a really good one. One thing I would just say to both of you and to any listeners, I think it'd be really interesting to go out and look at what the state of Ohio is doing. It's called One Front Door. And they're really getting much more involved at the state level in something like claims and the whole adjudication process, that whole cycle. And so I think that's creating, in the near term, it's creating some complexity, but I see that as a big solution for other states to consider. And, if this One Front Door solution really takes hold, I think it could help drive standardization. Because from our perspective at SKYGEN, we've already figured out how to do like auto claims adjudication instantly. Mm-hmm. It's very similar now to like banking transactions from our perspective. Mm-hmm. But we have to have partners that are able to kind of deal with that change, if you will.
Mm-hmm.
And so I see the Ohio move as a, it's sort of a tipping point, I think, for the Medicaid industry. The other thing I would mention is we have a really great partnership. Her name is Mary Foley. She's the executive director of an organization called MSDA. It's MSDA, and she focuses exclusively on Medicaid, and she tries to find kind of the common challenges and then pulls us all together occasionally to talk about them to help standardize or to promote automation. So she's a really good partner of ours, and is a champion around this topic that you brought up.
Awesome, very good. Well, that's great to hear the momentum and SKYGEN and the work SKYGEN does. I know Zoe has a couple of additional points. Zoe, you wanted to chat with Kyle about?
Yeah, I mean, really, we only have time for one more question, so I think I'll just ask my question. And while we're talking about SKYGEN, we know that there's a lot of challenges being faced right now. Can you tell us an example maybe of how SKYGEN has applied innovation to create solutions to those challenges?
Oh, sure. Yeah. SKYGEN is really kind of a unique organization, and it's been the organization has been around for just about 30 years, and devotes a substantial amount of investment into development every year. And recently we created a member mobile application specifically for Medicaid dental members to use. And so there were all the questions around, well, do Medicaid members have smartphones? And of course the answer is yes, they do. Will a Medicaid member go to an app store and download a mobile app specific to their dental? There are some challenges with it, but with the right communication, the answer is yes, they will. Then you get into, well, what kind of information should you put on the member mobile app, right? And as I mentioned earlier, I think it's really around the basics, like how do I find a dentist or an optometrist or ophthalmologist? What's covered? Can I use this mobile app as my ID card? And that's the way we're sort of pitching it. You don't really need a paper ID card or a laminated ID card. Just take your phone into the office and show them that you're a member. So things like that are very kind of basic, but again, it helps them with prevention and getting in to see their dentist periodically. So I would say that would be the example I would offer.
That's an amazing example. And I love that it really simplifies things for the end user, the person who needs it most. Any way that we can make their lives easier is a net benefit to us all. So that's a really cool example. Thanks, Kyle.
Yeah.
So that's all we have time for today. Thank you so much for talking with us. Thank you for joining us, Raheel, as well. It was great to have both of you here. So next time on the Health Tech Edge, we'll talk with Nick Sankvi from Caspio. So catch us on March 17th, and thank you all for tuning in. Take care.
Great. Thank you.